Most classes, I would love to talk a little bit about our hips. Maybe a little bit wider, because kind of that gives us a nice, good base of support. The narrower we stand, obviously, the more balance is required. So we'll just take a moment and to feel what the body, what it feels like, because we never pay attention to our body. We really almost flat. So we look at toddlers that just started walking, or like 3-year-old, 4-year-olds, before we sit them into school or kindergarten or whatever, their backs are actually quite flat, and it's good. So knees are bent, sits bones are back, and then softening the kidneys a little bit back. So that's going to allow for the ribs to drop a little bit, and just allowing for that lumbar spine to open. Don't want to ever open the lumbar spine by tucking our pelvis. That's something that's still being taught, I think, but I'd highly encourage you to not do that. So we're sending the sits bones back, and we're dropping the kidneys. And then just feel your breath. I can tell right away. I just want to make you aware. I don't want to put something in your head, but just aware. Wow, my ribs actually were expanding to the back on my breath. Don't worry about the head and shoulders. They're okay. We're okay. We have groundedness in the feet. We have engagement in the legs. We have engagement in the abdominals. And we're going to go for a little ape. One of my teachers would always say, go ape. And if we're standing like this, like most of us kind of do in some variation of this, we're actually shutting out the abdominals. We're compressing the lumbar spine. We're hanging on our hip joints. We're pushing into our knee joint. Our calves are perpetually overly tight. Our glutes are probably not very much online. So it's just the awareness. Can bend the knees just a little bit. Even just bending your knees will make a huge difference. Observe. You might want to look at your screen here, or maybe if you have a mirror close by. We're going to start to shift side to side, and you can put your hands on your hips. And the idea is just to observe, not going crazy here, but just see what is possible, and that there's a difference from side to side. This is really important. This is kind of how much can my hip go? I'm not pushing it. I'm just observing side to side. Now we're going to do this one more time each side. You find your side that's more mobile, and then you can ask yourself a question. Is this the side where maybe my back hurts a little bit more, my knee hurts a little bit more? I have a lot mobility here, and I have less mobility here. And the mobility is not always a great thing. Too much mobility, the brain says, let's not go there. And it starts to hold patterns around, not necessarily in the hip, because the brain does not distinguish between, is this the appropriate muscle? The brain just says, let's hold something. So we're not going. I stand, let's say, on my right leg here, and I'm checking or sassying my right hip, and then see if I can pick up my left foot. What's happening in the knee below? Is the knee really wobbling? Don't even go far out to the right. That's okay. You can also hold on to something, and then see what happens on the other side. Now see what happens when you go. I can tell right away here, my liability here for my knee, I can feel my knee moving back and forth. If I back my hip a little bit up, I feel much more support. Slightly more inward toward midline and not following your hip. I'll pick up that left leg. And then we're going to go one more time to the left. And now if that is your more mobile side, let's hold that mobility back a little bit and feels balancing. We do want to check the hip a little bit, right? We need that. But notice if you push, not even push, but if you just go where your mobility allows you to go, how does that affect your leg? How does it affect your back? Okay, so that is just a good way, I hope, I think, to check in with what's actually happening, what's going on with your pelvis. Because we're all different. I don't, nothing is, I don't want to generalize it. And maybe your hips are even and strong and perfectly aligned, whatever perfection is, right? Maybe you don't have any pain, but become aware of what mobility does here. So we'll see.